Hello, everybody. Oh my goodness, so excited for tonight. It's our final week. I can't believe it. So jump on, let me know that you're here. Say hello. I'm just going to check that we are indeed in the right place in the Belly Bootcamp group so that you can see me. Yes, we're here. Fantastic. Awesome. Right. Come and say hello. Who is joining me this evening? This is our Q&A session, week 6. How on earth did we get to week 6? I feel like this has absolutely flown. It's been just immense. It's been really, really awesome. Paula, hello, lovely to have you join me tonight. This is going to be an awesome session, fully interactive. So feel free to ask any questions as we go along, because basically this is the mammoth Q&A session that I always love to do on week 6, because for the first 5 weeks you end up with so much information and you start like implementing things, and then all these things start cropping up. So yeah, a Q&A is fantastic, and it allows me also, if people have asked questions that no one else has seen or seen the answers to, I can collate everything so that you guys all get the information. Hey Angie, awesome to have you here tonight. I've got all your questions coming through on the WhatsApp group, so we'll get to them, so that'll be awesome. Fantastic. Paula, first time you've sat down today. Gosh, it has been a busy day. Need to get my brain in gear to think of questions. Don't worry, we have plenty. So yeah, if you don't come up with any, don't worry. What I'll also do as well, because the WhatsApp group, the Ask Me Anything WhatsApp group is open, I normally leave it open for another couple of weeks. So you get kind of that 8 weeks worth of opportunity to ask questions. So if there is anything that comes up later, don't worry. Or if we haven't covered it tonight, don't worry. You can still get the opportunity to ask things later on. Okay, I'm going to do a little bit of a recap because we are on week 6 and we have covered a mammoth amount of stuff. It's been immense. It's been absolutely fantastic. So let's just do a quick recap then. So the way that the Belly Bootcamp program is set out, weeks 1 through week 5, plus the Q&A week 6, is basically your step by step. So really all you need to do is follow each of the steps, each of the weeks, one by one. And once you've completed one, you can move on to the next. And that is really the structure of it. It's super, super easy. So week 1, we covered the healing mindset. We got into the zone of what it actually takes to have a vision, have a clear idea of what we're aiming for, and getting that as our like really like into our heart center, so that our body, our mind, our soul, our energy, whatever you want to call that, your full being is completely behind that vision and focused in on it. We did this lovely meditation. I hope that helped to solidify everything for everybody. But basically, it's all about making sure that you're motivated and you're using that vision as your motivation and your inspiration, and you know that there will always be that roller coaster, that there will always be that flip side where stories that you have maybe absorbed through osmosis from parents, from people around you, those self-sabotaging behaviors, any of that can come into play at any point, and that's totally normal and okay, and to expect that on the journey. So yeah, our healing mindset is really important to get that in place before you even do anything, because change is challenging. Change can be really difficult, and doing things step by step and making it really, really easy means then that you're not having to really worry too much about the change. But if you've got your mindset in place, you're going to be able to cope with putting any new habits or behaviors in place, and it's going to set you up for a phenomenal journey towards that vision, which is going to be just amazing. I'm so excited for everybody. Week 2, we looked at those triggers, so things that are causing the body problems, whether it's an intolerance, an allergy, whether it's that autoimmune connection as well, so that body attacking self. We did a little bit of anatomy. We got used to like what is the gut, the window to the gut that is the mouth, all the way through, down and out, and some of those connected structures that are in the head as well. Week 3, we started diving really deep. So we went into the digestion and absorption, what contributes or hinders those processes, what we can do to make them better. And we started talking about this leaky gut syndrome. So this permeability of that barrier, that gut lining that is a barrier between the gut environment and the rest of the body, the bloodstream, etc. And that's where the immune system sits. That really important point, that is where the immune system sits. Then we did rebalancing the gut. Oh my goodness. How exciting was it to find out about all the things that we can get relatively easy and are also in nature, but that are antimicrobial, all the binders that we talked about in order to clean up some of the waste products and inflammatory factors and toxins like heavy metals. Phenomenal week, the rebalancing week. And then last week, all the things that we can use to create that really healthy gut environment, making sure that it is the best environment possible for the good gut bugs to thrive. And then we're making it as hard as possible for the bad gut bugs to cause us problems. So yeah, we covered a phenomenal amount of things. So let's have a think about the questions then. I've had a few that have come in, so I'm going to just go through them in the order that I've received them. I'm not, there's no particular priority to them. I'm literally just going through them in order. I had a question about how to build the program. So obviously when we were talking about rebalancing, I was talking about using the binders, using the antimicrobials in combination, and you can change it up as well. So I'd given a little bit of an example of a particular program there that you could use, just a way to combine the binders, the different kinds of binders as well, with the different kinds of antimicrobials. If you're in doubt of where to start, just start with one, like just even start with a binder and see how the gut reacts. So maybe you go for your activated charcoal. Literally, that would be the only thing. You don't have to combine it with an antimicrobial at all, even to start with. You can use all of these individually, or you can use them in combination for a bit more of a punch to those bad gut bugs. But you could just start with activated charcoal. And if you really want, you could combine it with like a garlic or an oregano oil. They're the two that I kind of always recommend starting with, because they're easy to get hold of and they're really cheap as well. They're not really fancy, expensive ones that you've got to worry about keeping it in a fridge at like minus whatever temperatures. Like, there's nothing fancy about garlic, oregano, and some clay. Like, super, super easy to get hold of. I don't think the last the last video actually sent out properly on the replay, so I will check that as well tonight. I was away and I was in a hotel and their Wi-Fi was terrible. So yeah, I need to double check you've actually got all the replays to go through. If you can't find any, please let me know. I'll resend them out to everybody so you've got them. But yeah, the program is really easy. You can just start with one thing. I often teach the just one thing strategy to my clients, because often when you're trying something new and you're looking at doing something that is completely new, it's not automatic, there's no ease and flow to it, it feels like a bit of a challenge. The just one thing strategy can be amazing. Literally, you pick one thing. You don't need to worry about anything else. It's just the one thing. So yeah, that could be your activated charcoal. And then that would be it. And then once you're happy with that, once that's automatic, then you could add one more thing in, and that's another just one thing. So yeah, you don't ever have to worry about having to do all of these things at the one time. You can literally pick one, go with it, see how it makes you feel, up the dose, see how that makes you feel, change it up, ask some questions, take it at different times of the day. It might work better for you at different times of the day. Some people find that things work better on an empty stomach than they do when they take them with food. So you could play about with just that one thing, and if you wanted to, play about with when you're taking it and if you're doing it on an empty stomach or you're doing it on with food. So yeah, hope that answers that one. Detox then. I got asked about detox. And I'm going to say what I said when I was doing the rebalancing week. This is the last step of the last step, because you've got to get all the other ducks in a row, basically. You've got to get the nutrition optimized. If you've got deficiencies, if you're low in anything, if your ratios are off because everything works together, you're not going to be able to detox properly. So before you ever think about starting to pull heavy metals out or doing particular cleanses with some of the either the some of the herbals or some of the practitioner restricted products, you get them little bottles, you can get them through myself. You want to make sure that you've supported everything and everything's working and you've optimized, you've got all of those levels up, because when you start pulling things out of the body, you're activating and putting extra pressure on the detox pathways. So our detox pathways are our liver. That's also then our digestive system, because we're putting toxins into the bowel to be bound up in our stool, our urine pathway as well. We breathe out toxins, we sweat out toxins. So yeah, there's many different detox pathways. The liver as well has 7 different chemical detox pathways that it uses too. So you've got to have all of those components in play and at optimized levels. Liver working well, kidneys working well, digestive system working well, before you ever go for that detoxing and actually pulling things out of the body. So yeah, if you're putting extra pressure on a system in the body or an organ in the body that can't take that added pressure, that is stress, and stress just increases all of our inflammatory responses. So we can become inflamed, and if you're prone to like swelling, maybe edema where you get fluid retention, if you get sore joints, all of that will start to basically become worse or more evident and flare up because you're flaring up the inflammation. So yeah, you can aggravate things doing that. So yeah, support first, optimize second. Ideally reduce those inputs as well. So that's things like obviously avoiding your trigger foods, and then your detox, your rebalancing. That is always, always, always the last step of the last step. I don't know how many times I'm going to say that, but probably a lot more. Okay, I had a really interesting question about HRT. So a lot of women nowadays are getting access to hormone replacement therapy, whether that is bioidentical or not, different types of hormones as well. So some women will be on estrogen, like patches, etc. They might have progesterone cream. They might even be getting testosterone. So a whole host of different hormones. I was asked, does this affect any of the process in terms of what we've detailed through Belly Bootcamp through the 5 weeks? So no, other than if you're using herbals. So you can pretty much take it anything else. I would always take the binders away from taking anything if it's oral as well. So the binders, I would probably give yourself a couple of hours if you're taking something orally that is a binder, just to make sure that there's nothing that it's going to accidentally bind up and then isn't available for the body to absorb and use. But in terms of the herbals can interact with any other medication. They can interact sometimes with some of the hormones, but again, it depends how you're getting it. So if it's a patch, you'll be absolutely fine because it's going in through the skin. It's more if you're taking it and it's all going into the digestive tract. So sometimes there can be some interactions, but I would always say, rule of thumb, have a gap of an hour to 2 hours between things if you're taking them orally, and always check if you're taking herbals, if there are any interactions with any medications, including any HRT. But yeah, should be fine. The only other thing as well is, so estrogen is processed through the liver, so it is so even if it's synthetic estrogen, it is broken down and excreted out through one of the 7 pathways, the chemical pathways that the liver uses. So if you are detoxing and you've also just started HRT, so that estrogen level has gone up if you're on estrogen HRT, your liver will be doing more work because it's not used to processing all that estrogen all the time. So yeah, if you're detoxing and you're using your detox pathways and you're putting extra pressure on the liver and you're combining that at the same time as starting HRT, you're probably adding a little bit of extra stress because it's extra work for your liver. Hope that makes sense. Okay, what else have I got? I think I've covered a lot of them actually within the program. So another question was how do I make sure I'm killing the bad gut bugs? This comes down to that rebalancing. So that is your antimicrobials. So again, easily enough to start with your garlic or your oregano, or start working through the list that I detailed. So the biggest thing probably with the rebalancers is that you will hit a point where you're not getting quite the same result any longer, because the gut microbiome, bacteria, yeast, viruses, mold, they're all alive. They don't want to die, they want to survive just like we do. So if you're taking antimicrobials and you're hitting them hard with the antimicrobials, some of them will die, but the ones that hang on are the ones that are maybe a little bit more tolerant to that specific antimicrobial. So you kill off the ones that, like, the easy kills, if that makes sense, like the really easy ones, and you get left with the ones that are a little bit more stubborn to shift. That's when you need to change the antimicrobial that you're using. So if you're using the same thing, so say you're using the oregano capsules, for example, and they work beautifully and brilliantly to reduce symptoms, stop your symptoms being so bad if you're taking them before maybe you're having something that sets your gut off. If you're using them that way and they're great to start with, you might find that eventually that effect reduces and they're not as effective. And that's because you've actually killed a load of those easy targets. All the ones that are really, really sensitive to the oregano are already gone, and it's the stubborn ones that are left. So we shift it up, we change it, and we use a different antimicrobial and come at them from a different angle. That's basically what we do. And because there's so many different antimicrobials, you can just keep chopping and changing. So your bad gut bugs don't know what's coming next. I use oregano quite a lot. I use it kind of in rotation with things. So that again is just to keep it mixed up so that the gut bugs don't get too used to something. And then I just end up with the really, really stubborn ones left. I switch it up every now and then, and they kind of don't know what's coming. They just they get kept under control because I just keep shifting things and changing things for them. Does that make sense? So yeah, you can change it up, and you won't always get the same efficacy. That's the word I'm after. The same effectiveness with the one antimicrobial all the time. Okay. Let me have a look. Okay, let's move on to some of yours, Angie. I'm just going into the WhatsApp group. Right, I'm just going to go through them in order as well, and let me know if I've missed any as well. The first one is, does yeast have a connection to eustachian tube dysfunction? So eustachian tubes, like the tubes in the ear, basically dysfunction often is just when the tube itself is inflamed. Okay, so there's lots of different options in terms of the root cause of that inflammation. Sometimes it is because of infection, things like the common cold, flu, so bacteria and viruses can cause an issue within the ears. It also might be due to just additional mucus, and again that could be from some other maybe infection going on in the body that has increased the inflammatory markers, so that inflammation, the immune system communicating, because that's what inflammation is. It's all these inflammatory, pro-inflammatory signals, cytokines they're called. You get some that are anti-inflammatory, but the majority of them are pro-inflammatory. And they're whizzing around the body, talking to everything, and then they can inflame other tissues. So it could be actually that if you've got an infection in one part of the body, it can cause inflammation in the other parts, because that inflammation systemically, whole body inflammation, that talking, those cytokines that are in the bloodstream, they're basically making a whole host of other things inflamed that maybe are not directly related to the infection. They're somewhere else in the body. So actually that can be the cause of eustachian tube dysfunction as well. Yeast connection though. So yes is the simple answer, because it can actually be an infection within the tubes within the head. So obviously we did a bit of that anatomy part in one of the weeks where we were looking at the connected structure, so nose eyes and ears, because they all connect in around the throat and the sinuses with the top of the digestive system. So when we have these overgrowths, so whether that's in the mouth, in the esophagus, whether it's in the stomach, whether it's in the intestines, the candida, if it's white yeast specifically, same as bacteria and viruses, they pretty much can move wherever they want through the body. They often use the nerves to travel about, specifically that vagus nerve. The vagus nerve comes down from the brain and it has all these different branches that basically branch off and pretty much connect every part of the body through the vagus nerve. So it's like the all access pass, like the master key to the body. So any of our gut bugs, good and bad, can travel along the vagus nerve as well as other nerves, but the vagus nerve in particular, just because it's so well connected, and get anywhere in the body. When you've got imbalances in your mouth, especially the yeast, it's at the back of the throat. It's a really easy jump up and into the sinuses for the nose, affect the eyes, and into the ears. So yes, you could have yeast within those structures. They could be causing that inflammation, that build up, the blockages, the extra mucus, the potential damage, if there's damage to the eardrum that's been caused by any of those blockages. So yes, the tubes in the ear can be really, really tiny too. So some of them block really, really easily. So yeah, I hope that answers that question for you, Angie. So yeah, the simple answer is yes, could be a yeast issue. And often it's relatively easy once you know the kind of signs around the other parts of the body to go, oh, I've got a yeast problem. And it may be contributing as well to the eustachian tube, but it might not be the only infection that's contributing to the eustachian tube. So we didn't really go into this in terms of the way the immune system works, but we often think of one infection, immune system kills it, gone. All the symptoms disappear. But actually, when the immune system's not quite working properly, and when also the immune system's lost that ability to tell the difference between self and non-self in autoimmune situations where it's attacking the wrong thing, there's a lot of low-grade infections. So the immune system might keep them down enough, but it doesn't actually clear them. So that's one of the things I've dealt a lot with, is actually these kind of really chronic but low-grade infections. And it takes a bit of time sometimes to actually work through all of them, because it could be that you've got multiple bacterial infections, multiple viral infections, and multiple mold infections all in one go. So the eustachian tube issues could actually be a cumulative, layered upon layered infectious issue, and it's just going through each in turn, using the antimicrobials to get rid of. You can use a lot of herbals that attack or stimulate the immune system specifically to go after particular infections. There's one that I've used that's been really, really great, because obviously COVID likes to linger in the nerves. So yeah, it's a really good one to help the immune system be able to go after these infections that kind of go into like stealth mode, hide in the nervous system structure, and then it means then that they can pop up at any point, or they're just creating low grade inflammation. I've got another client at the moment who has a really, really sore jaw. And again, we think this is partly because she's got some really low grade infections that are causing problems in the actual hinge in the jaw. And it gives her really awful pain along the nerves in her like in her jaw with her teeth, etc. So yeah, we're looking at clearing out layer upon layer of these different infections that potentially, without even needing to be tested specifically for any, it's actually quite easy to just work your way through, and it means that anything you've got just starts getting cleared out. But again, that's part of the rebalancing and the detox step. So it's the last step of the last step. Going to say it so many times. I can feel like I'm on repeat with that one. Okay. How to increase streptomyces in the gut? Very good question. Very good question. So this is the good gut bacteria. There's lots of different ones. The majority that we talk about are lactobacillus species and bifidobacteria species. So streptomyces is a different species. It's not one of the kind of more common ones. Actually, the best way to do this is you'll have some sort of low grade population already. But if you've got really low numbers, it's maintaining a good gut environment to allow them to thrive, and then getting to the point where you have supported all your body systems, you've optimized all your nutrition, you've maybe done that push strategy with the minerals, so that you're starting a slow detox, but by upping your mineral levels rather than doing a kind of active pulling out detox, you're using that mineral push strategy. And that's going to then start creating a change in the conditions within the gut that's going to allow the good gut bugs like the streptomyces to survive so much better. And then when you get to the point where you're actually killing off the bad gut bugs, you're then creating space in the gut for the good gut bugs to repopulate, to grow into. Okay. I hope that one answers that one as well. So yeah, the streptomyces is probably not one that we would go, oh, you can just easily pop a probiotic pill for. Don't really tend to get streptomyces in a probiotic as such. But if you're creating the right environment, it will grow, which is fantastic. And then that allows you to actually target some of all the other pieces that build up the bigger piece of having a really good, healthy gut environment. Okay. Hope that makes sense. What else have we got? How to heal exocrine pancreatic insufficiency. I take it you're meaning then when your pancreas is not creating enough digestive enzymes. Is that what you're asking? So the pancreas is obviously an organ within the body. It produces a bunch of different digestive enzymes that then end up within the stomach, etc., to help break things down. If the pancreas isn't working properly, there are some things that you can do to support pancreatic function. It's a little bit controversial because I like when there's certain organs that are not working, I like treating them or supporting them through actually taking the corresponding organ of either pork, like a pork or beef. So you're actually having organ, so pancreas. So it's like what we call a glandular therapy. You're actually taking pancreas that has maybe been freeze dried and put in a capsule, or freeze dried and created into a tablet. So you're using a glandular therapy. It's very much this kind of like stimulates like. So if you're taking some of it, it supports the corresponding organ in us. And it means then that if there's any factors, whether that's digestive enzymes, etc., that have been produced within that pancreatic tissue that is now a supplement, that glandular supplement for you, you're also getting the benefit of that. Equally though, with some of the digestive enzymes, you can use your herbal bitters to stimulate this. So things like your dandelion, I think I was talking about potentially wormwood. There's a bunch of herbal bitters that stimulate us to produce our own digestive enzymes, which is great. So actually that ties in then with stimulating the pancreas too. Okay, so that's probably the easiest way to do it. And the organ therapy, so that glandular therapy, some of the tablets, I've been on these myself because I've had issues. They are not the nicest tasting. And the idea as well is to stimulate the digestive process. And you know how I was talking about like the digestive process like tastes what you're having all the way through. So it can set the wash cycle. It knows what kind of ratio of digestive enzymes it needs, because it's basically testing and tasting what you're eating at all points. You have to chew the tablets that are the glandulars, these like organ-based tablets. Some of them are fine, some of them are horrible. But to get the best and most efficient response from our own bodies, we have to chew to get the taste buds tasting them, to get the flavor in the mouth, to get the body recognizing what they are. Boke indeed, Ange. Yeah, Angie, they're just so like they're not. Some of them are absolutely fine to chew. They're not that bad, and other ones are just horrible. but they are really, really effective. So it might be then that if you can get a powdered one, you can add it into something, so you're not tasting it. Some of the ones I've had in the past have been tablets, so you've literally got to chew them up. I have tried soaking them so that I can then hide them in things because they're just so nasty tasting. So yeah, there's different strategies. Equally, those glandulars can be quite difficult to get hold of. Sometimes I've had great suppliers, and then there's been legislation changes, etc., and it just makes it really, really difficult to get hold of glandulars. So again, if you're wanting to go down the glandular route, I would try and work with a practitioner who could maybe source them for you, because they can get a bit tricky. Whereas the herbal bitters, you can get herbal mixes really, really easily. You can even do a very light touch with the bitters and go for something like a dandelion tea. So a much more reduced potency than like a tincture or something that is in alcohol, like herbal extracts. But you could have a tea, probably just tastes a bit planty, maybe a little bit bitter, but it will stimulate the parts of the tongue that taste bitter as well, which often those taste buds start to get kind of a bit muted out because we are so used to having sweet all the time. So the sweet part of the tongue gets overly sensitized, and then the other parts of our taste and palate profile get a bit numbed out because they're not getting stimulated. And then with the sweet one, we also end up having like a bigger sweet input to get the same dopamine hit in the brain. So that's like a whole other course. Palate and sugar reactions and opioid receptors and all of that. Okay. I won't go off on a tangent. I'm sticking to the questions tonight. Let's see, what's the next one? KN intolerance. Would the same reaction happen with actual chilies? Ooh, that's a good one. I like that one. So KN or KN peppers, as they're sometimes referred to, are like our chili peppers. So yeah, there's this hot, spicy capsicum style extract that you can get out of them. Like this hot spiciness is part of the pepper, not all of it. It's just part of it, but obviously when it's in your mouth, it feels like it's all of it because it's on fire. So yeah, if you were eating chilies, I suppose the hotter they are, the more you're likely to have an intolerance if you're having a KN intolerance, because KN you can also get as like dried powder, and you can get add that into chilies and things, as opposed to a bit like your chili powder. But yes, I suppose the hotter the chili, the more of that hot spicy, all of those chemical compounds that create the hot spicy flavor that you'd be reacting to, would more of them would be present the hotter the chili is that you're having. So if you have a really, really, really mild chili, you might not react at all because there's not really any of those hot spicy compounds in it at all. Okay. Retest after increasing supplements to see if it's worked. Yes, you could totally redo the hair mineral analysis after a period of time of implementing things to then see what's changed. So if you have been addressing food intolerances, you could see if they're still having an issue at cellular level. If you are upping your vitamins or minerals, it could be that you find out that actually your levels of the ones that you've been working on to get up are now completely fine, and they're falling within the normal range, and they're not coming up as a deficiency any longer. So that actually would be really, really helpful, especially if you've got some quite serious deficiencies. You can then do a check on them. I always think that if you follow the kind of pattern or the recommendations that I pop in the summary email for the deficiencies, a lot of the time people continue on with things, or if in subsequent consultations we are trying to actually address particular things, it might be that those items come back into play, and actually we just end up with you taking them for a bit longer. But normally within the summary emails, I'll give a couple of weeks at like a double or sometimes a triple or quadruple dose. So that's this therapeutic dose that we're looking at. So higher concentrations of it, higher dose for a shorter period of time, and then you come down to more what we call a maintenance dose. So that's a lower dose for a longer period of time. Equally though, and I'm sure I mentioned this in one of the other weeks, that the bottles that you get the supplements in might have a recommended daily allowance on them, an RDA, but that actually may not be optimal for you. So I know for certain things, for me, like B vitamins, I just need a higher dose. Like the recommended daily allowance on a bottle is way too low for me. It was also calculated because it's just to stave off disease. It's not actually optimal for health. So yeah, if you feel you need more, take more. If you're doubling a dose, even if you're taking, so if the bottle says 1 capsule and you're taking 2, it's unlikely that you're going to be overdosing on things. So the dose makes the poison. I definitely prescribe to the dose makes the poison. So even with water, you drink too much, it's going to cause you a toxicity problem. But when it comes to supplements, the recommended daily allowance is so low, even if you're doubling that for the majority of things, you will be absolutely fine. There are some vitamins and minerals that the body will store, totally fine. And then there are others that it doesn't. So like a vitamin C, we cannot store it. We cannot make it ourselves. We've got to get it from our diet. If you take too much of it, you'll just have a little flush through. You'll get a little bout of diarrhea because the body's like, no, we don't need any more. Thank you. Bye-bye. So you'll just get a little flush through of your vitamin C. So if you're taking too much, but even with vitamin C, I think most people would take a vitamin C tablet. I'm going off on a little bit of a tangent now, just popping into my head. Most people would take a vitamin C tablet and it would maybe be a 200 micrograms, 400 even. That's nothing. The body can, especially when you're ill, can tolerate up to about 9 grams of vitamin C, 9 grams. So a lot of people who take what's termed a high dose vitamin C supplement, it's actually a gram a day, and that is supposedly quite a high dose. For some people that really is, like maybe they get to a gram and that's way too much and they just end up with diarrhea and they flush through, the body's like, no more, thank you, we're good. I've had other people who need 4, 5, 6 grams a day, like their body needs it. So it depends what's going on for you. Vitamin C and zinc and things that are involved in the immune system, if you are having an active infection, if you're really feeling run down and stressed, if you're having an autoimmune attack where the immune system's dysfunctioning, you will need more of those. So like vitamin D, vitamin C, zinc, maybe magnesium and potassium, some of the other electrolytes, you'll need a higher dose of them when you're feeling that way, or that's happening in the body anyway, because the body has a higher need for them. Okay, less the tangent, Claire. I'm imparting all the golden nuggets today. Never mind the questions. Okay. What are the reference ranges of the others tested? And I think you've specified by others, you mean vitamins and minerals. Yes. So in that test report, it's kind of traffic lighted as like a color coded system. So it doesn't actually tell you what specifically the levels are in a number. It tells you the levels in red, amber, green. So green being for the vitamins and minerals in balance. And actually, I think you just end up with a green and a red for the vitamins and minerals. So it's just in balance and out of balance. So with the out of balance, those ones are the kind of top 20-25%. So if anything is not in balance and it's hitting something that is coming up within the kind of the top area of deficiency, you're going to end up having that come up as red. It does mean then that you don't quite know where it's sitting. You do know if it's on the list, it's causing you a problem. It's a deficiency. It's low. We need to get levels up, whether through diet, whether through supplementation, get those levels up. But it means then that it's not quite as easy to do a comparison. So if you got the hair mineral analysis repeated, all you still would get would be ones that are in balance, ones that are out of balance. So it would just mean, has that item moved from one list to the other, as opposed to saying, oh, well, it's up so many points or it's down so many points. The lab does this because for most people, that is an easier way to access the information rather than having a number, because then that can start getting quite confusing for people. So it's just an easier way to represent the information. But you could certainly repeat the test and then see what happens. Equally, though, through conversation with myself, I might be pulling out other information that suggests other things in terms of the vitamins and minerals. And therefore, it might be that we do an approach, and you might not be fully aware of all of the thinking and what I'm addressing by asking for maybe certain behaviors or certain things included in the diet. Or, I mean, there's so many things. It could be eating at certain times. It could be starting to go into the kind of intermittent fasting realm. Like, there's a whole bunch of things that actually hit a bunch of different things all in one go, but we might be talking only about a few, but they're also contributing positively to a few other things, because I use a lot of techniques that actually do things right across the body. They'll target what we're needing to target, as in the priorities, but they'll also do a bunch of other things. I'm trying not to give like complicated examples here, but I hope that makes sense. It's like my nutritional therapist brain is pulling all the pieces together, and then we might talk about one or two pieces, but I've got another 5 or 6 pieces in my brain that I'm then like, right, if we do this, we can hit those two, but we can also hit all of these at the same time. Does that make sense? I feel like I'm not making sense, so let me know if I'm not. Okay, let's see, what else have we got? My phone keeps shutting itself off. Oh, I think that was all of your questions, actually, Angie. Yes, I think I've answered them all. I hope I gave some really thorough answers to those. And there might have even been some stuff in some of my tangents now that you have questions about. Please feel free to ask. So yeah, let me know if anything has come up in any of that, or you've got any follow-up questions from the answers that I've given to those. Because I know sometimes when you're explaining something, there can be some other things that pop into your head about anything. So yeah, pop anything into the comments if anything is cropping up and coming to your mind at the moment. I'm going to go back to my other list of questions just to see if I've got anything. How do you know if leaky gut is healed? That's a fab question. So leaky gut's that permeability of the gut lining. So it's stuff that should stay in the gut, getting through, and the immune system is having to deal with it because it's getting into the bloodstream. So we know that stuff's getting through and into the bloodstream. Now, different people will have this create different symptoms in different parts of the body. So what we can do is we can then identify what are the symptoms of leaky gut that you have been experiencing. And then we know when those symptoms start either reducing or go away altogether, we're getting a healing of the gut lining, because you're then not getting those toxins in from the gut into the bloodstream, and then you're just not having the effect of them, and you're not having the ramping up of the immune response, and therefore it means then you're not experiencing it. So say, for example, one of the biggest ones I get when I eat gluten is brain fog. Like, literally, you would think that I was like brain damaged when I have the level of brain fog. And I don't say that in any negative or condescending way to anybody that has any issues with their brain function. Just like, you would think that part of my brain had died, that I had real severe brain damage, maybe had a bleed on the brain or something, with the severity of my brain fog. And this is because of the action of gluten on that permeability. It creates leaky gut, and then all this stuff gets through into the bloodstream. For me, it then crosses the blood-brain barrier, and I end up just not being able to function at all. So I know that when I am maintaining that permeability, so maintaining a more impermeable, I should say, so it's not as permeable when I'm not having gluten. So as long as I'm staying off gluten and doing a couple of other things around dairy and some other things in terms of my gut environment, so I'm creating a nice gut environment so that there's not as noxious a cocktail in there as well, so that if there is any permeability, the noxious cocktail isn't getting out. But if I'm doing quite maybe sort of 5, 6 things in combination, I then don't have the leaky gut. And I know that because I'm not getting the brain fog. So I can remember my name. I can remember a conversation that I've had with somebody. I am not losing words. Like, I've had to relearn words after having bouts of really bad brain fog because the I'm sure I've actually had damage to brain cells through the toxicity levels, and therefore the immune system having to take so much action in the brain to clean it up. Like, I literally, you'd be like, Claire, anybody home? Spaced out. And I feel like that. Like, I'm like, what am I doing? Like, why am I here? It's horrible. It's so, so horrible. You feel like you're almost no longer connected to your body at all. Like, you're still there and in it, but there's just nothing makes sense anymore. You can't join the dots for anything. You can't have a proper conversation. You'd have no memory of anything. You can't recall stuff. You can't talk properly. Like, really, really, really severe brain fog. Um, so yeah, for somebody else, their leaky gut symptoms might be really bad skin. So they might have really bad eczema. So their that element of leakiness will be less when they're not getting as bad eczema flare-ups, or if it clears up altogether, that would be amazing. For other people, it's migraines. So sometimes when all the toxins come over and into the bloodstream, the blood's taking them around the body, they might get into some tissues, some of the nervous system structure, into the brain. It causes tension, it causes overstimulation of the nerves, which can then create awful headaches and migraines. And it can make all of the muscles really tense. Equally, when there's toxins and you're thinking muscle movement, so that's those electrolytes, so your calcium, your potassium, your sodium, magnesium, they're all required for when a cell fires, or when a nerve cell fires, to give like a contraction or a relaxation signal to a muscle. So when you've got a whole bunch of toxins and you don't have the correct electrolytes to have that signal fire properly, you can end up with stuff like the muscles and the muscle fibers all bunching up, and that's where you can get all of this tension in the neck, in the head. The nerves are then super sensitive to pain. You can end up with this like pounding headache and this real piercing pain experience, which can be really, really nasty, and then obviously affects vision and sleep and all sorts of energy. People get really, really tired when they're in pain all the time because of all the energy that it saps from you. So yeah, not nice at all. Does that answer the question, Angie? I feel like I'm trying to give examples here, but I want to make sure that they're relevant and that you understand what I'm on about. Does that make sense? What else could you have with leaky gut? I mean, loads of different skin issues. So my acne definitely flares up when I've been eating rubbish, and part of that is because I'm detoxing through my skin. Part of that is also because of that permeability aspect to the gut, which just lets all this stuff into the bloodstream, and then literally my immune system's playing mop up, and trying to go after everything before it causes a problem anywhere else. But the biggest issue with leaky gut is that it can actually cause any sort of symptom at all, because if you think about it, it's basically toxins getting into the bloodstream, and then the bloodstream can take them anywhere. So that means that they can get everywhere, and they could cause a problem anywhere in the body. So actually the symptoms that people experience can be quite different, and they can be of different severities as well. So yeah, leaky gut symptoms are vast, and they are very specific to each individual person. The one thing as well that I haven't really talked about is what I call the if you think of like a chain with all the different links, it's the weak link. Um, the weak link is different for everybody, and what I mean by that is that if somebody's having an issue, so I don't know if you can actually see at the moment, but right just at the corner of my eye, I've got this kind of sore. Um, for some reason, one of my weak links is around my eyes and the corners of my eyes. Sometimes also the corners of my mouth. But the corners of my eye, and my left eye in particular, is like a weak link for me. Um, so when something is going on, often gut wise, often when I get a bit of an upset stomach or it's doing some burbly gassy stuff, I will end up with like little red bits, like little, not quite spots, because they're not pussy, like they don't seem infected like they've got pus in them, but they are red and angry and they come up under my eyes. And often I will end up with one that is in the corner of this eye for some reason. So yeah, I've got some gut stuff going on at the moment, and I've got my little red thing at my eye. I don't know. Let me see it. Yeah, just there. So yeah, that's one of my weak links. My joints are also a weak link, and I call them a weak link not because I'm necessarily saying that it's a weakness. It is a part of the body that shows symptoms for you more than other places. So my joints also are another one. My knees in particular, there was a couple of years where my knees were so sore, and I actually injured both of them because the some of the I can't remember whether it was tendons or ligaments. I partially tore one of them. I can't remember which one it was. And it was at the point where you couldn't go to A&E. So I ended up having like this really odd conversation and then a video call as my A&E appointment, because I'd literally like partially torn something in my knee. And it's because when I am inflamed, but systemically, so again, that it could be something else where in the body that is infected, that's then causing all of these inflammatory communication molecules that the immune system's producing because it's talking lots, that are then inflaming other tissues. My knees get inflamed first. They're just they're like the weak link for me for inflammation. So I know if my knees are causing me a problem, there is some serious inflammation going on in my body, even if nothing else is reacting at all, but my knees are sore. There's serious inflammation in my whole body, and I've then got to put steps in place to get it pulled back. Tied to tendonitis, it could be, yes. So where you are getting anything that's inflamed in the body, it could be that it is that systemic inflammation, and it's just that for you in that particular place, that is where you feel it first. So it's actually great if you know this. So I know that if my knees are bad, I know it's whole body inflammation and I've got to get that down. It's not actually necessarily an issue with my knees. However, like I did the other year where I partially tore a bit, if I leave them inflamed, I can then have issues with them, because then, so literally my knee was my left knee was giving way and just collapsing under me. Like it was so inflamed, it wasn't working properly. That is then when you end up with a specific knee problem, because I'm damaging the actual tissues as opposed to them just being inflamed as an inflammatory response. They were actually damaged because the inflammation caused a weakness and it wasn't able to hold my weight consistently. And then I just dropped one day. It just went, and then I was like scrabbling right for something to hold on to. So yeah, then I damaged it. So yeah, if you've got somewhere in your body that you know, like what is that old wives' tale, isn't it? Like, oh, when it rains, my hip's sore, or my pinky finger is sore, or something, like the joints in the pinky finger. That's exactly like it. It's like, oh, it's a bit damp, it's a bit cold, the body's not quite liking the situation, the conditions are not quite right for it, and the body is having a physical reaction, whether that is an inflammatory one or what. But yeah, it's these little signs that the body is giving. So as long as we are aware of where they are in the body and we're listening, the body will let us know, and then we can take steps to sort it out. So yeah, I know when my knees are sore, it's not a knee issue, it's probably a gut issue. If I'm completely honest, I've probably been eating a lot of rubbish, and that permeability, that leaky gut is just more than it should be. And maybe I've been feeding something in my gut and it's creating a whole load of horrible, noxious waste products. And then you combine the noxious waste products or higher levels, higher concentrations of it in the gut, but then you add the leaky gut in, and then suddenly you've got some really nasty stuff getting out and into the body. And my knees are like, whoa, what are you doing? we're really sore, you've got to sort this out. So yeah. Sometimes you can have leaky gut and there's no issue because the gut environment's really clean. There's no heavy metals, there's no big overgrowths causing problems, there's no parasites getting through, there's no toxic waste products. Sometimes if the gut is relatively clean, there's nothing that would cause a problem. The leaky gut actually isn't such a big issue unless you're getting partially digested food through, and then you see a kind of snowballing of food intolerances specifically, rather than brain fog, inflammation, pain places, headaches, skin issues, etc. It'll be more food based, so it's going to be intolerances because the immune system's then reacting to the foods or the partial digested bits of food that are getting through and into the bloodstream. So yeah, your knees too, Angie. Yeah, it's funny actually because when you start delving into a lot of information about very specific conditions, when you start looking at people who have formal diagnoses of things, you start seeing you need a lot of numbers generally to see trends and patterns in this, but you actually see a lot of patterns between people who have been diagnosed with the same thing. So, for example, Hashimoto's thyroiditis or hypothyroidism is what I am diagnosed with. A lot of the data shows that people that have thyroid issues, specifically Hashimoto's, have had a neck injury in their past. Now, I trapped a nerve in my neck when I was 13, 14, something like that. Horrible experience, exceptionally painful. I was kind of like sat with my head like this, and even now the muscles seize up and tense up really easily in my neck, and I do often sit sometimes with like my head slightly at an angle, and that's because it was like that for years, because when you trap a nerve in one side, the muscles do different things but on both sides of the neck. So yeah, you find an awful lot of people with thyroid issues actually have some sort of neck injury, whether that is like a car crash whiplash style injury, or like me, they've been sitting poorly. This was when I was studying for exams, so I was sitting poorly, all slouched over, and then actually it went when I was in the shower, and then that set me up for years of them kind of both sides going. So I have had to do weird and wonderful things with very fancy pillows for support overnight. I've got to be really conscious about how I sit. My neck cracks a lot as well. It's been much better since I've been going to the chiropractor for the last year and a bit. But yeah, there's definitely trends. So yeah, a lot of people find that with it high inflammation, whether that is leaky gut caused or not, is that particular joints will be very, very inflamed and sore. So for some people that is the knees, for some people it's wrists. Like when I was actually having really, really bad flare-ups, so probably from what, mid-20s to I want to say, when did I start going gluten-free? I think I've been gluten-free for nearly a decade. Must have been at least from about like 23, 24 until about 29. Like my wrist. So there's this kind of like, I don't know if you can see it under the light. It's a wee bit bright, but there's like a little bit in the wrist. I don't know. There we go. That's probably the best you're going to be able to see it in the light. But there's like a little kind of dimple in between the bones. I didn't know that was supposed to be a little dimple. Mine was all puffy. Like my wrists were always really puffy. And I had cankles. Like I didn't have ankles. Mine just went leg foot. I mean, I laugh about it now, and I didn't realize. I didn't realize that I just didn't have any ankles. I just had cankles. Like they were so swollen. So yeah, that inflammation shows up in different places. So if you've got a place in the body that it is definitively talking to you and saying, yes, my inflammation is way too high, there are so many things that you've learned within this 6-week program that allow you then to start addressing it, because you can directly address the leaky gut, you can directly address what you're eating, you can create that good gut environment, which then means that even if the leaky gut is in play, you've got less noxious material getting through to it. And then if you do have any food intolerances or unfortunately for some people, food allergies, you can then make sure that you are not aggravating the immune system when you've got sore joints, brain fog, bad skin, whatever, because then you're just adding to all of that inflammation and that leaky gut, because you're just pushing things through from the gut that then shouldn't be getting through and into the bloodstream when you know you've got those leaky gut symptoms, so you know what's happening. Paula, no worries, it's all being recorded. I'll send it through and I'll make sure it's sent, because I'm sure the last one didn't send properly. So yeah, I will make sure you've got all of this so you can get it and you can catch up on the bit that you missed. Don't worry about it at all. So Angie, knees, wrists and neck. Yeah, it's really interesting, isn't it? You start seeing patterns with people when you've got particular diagnoses in place that, yeah, there's a lot of similarities. It might not be exactly the same, but there are common threads throughout, which are really, really interesting indicators of some of the things that have been going on for people. So yeah, that link between neck trauma and thyroid disease is really, really clear. The other thing, actually, and this is specifically again for people that are very toxic. So I know as part of autoimmune disease, toxins are really high. Unfortunately, you can trace them back. So when you're in your mum's womb, your mum's basically pumping through the placenta all of the nutrients that you need, all of the blood to carry oxygen, and then to carry waste products away so that mum detoxes for you. But mum also pumps a whole load of toxins that have been built up in her body for the years before she got pregnant with you, and she's pumping them in too. Now, I'm not blaming mums in any capacity, anywhere, at any point. It's just a fact, because you're putting everything from the body into baby, and that includes all the good as well as the things that could be problematic. So actually, we also find that people with autoimmunity or immune dysfunction, or things where there's a susceptibility to high inflammation, that there are these high levels of toxins, and often they have been started in utero, so when you've been in the womb. So even when you're first born, you've actually got a toxic load, this what we call body burden. You've got quite a high body burden already, as opposed to just what you've accumulated as being a separate being through food, through water, through breath, breathing in everything, eating things, drinking things, touching stuff. We accumulate. So the longer we're here on this earth, the more and more we're going to accumulate things, and it's doing things and eating certain things that help to bind them up and get them out the body. But we do see that for people who have chronic disease, for people who have been diagnosed quite young as well, or for people that have had problems all the way through and just nobody's ever been able to pinpoint stuff, and then maybe they've got a diagnosis quite late on in life, we find then that there's actually quite a high body burden. That toxicity level is quite high. And that's probably because mum's toxicity has been high, and that's then transferred while baby's been growing in the uterus. So yeah, not blaming mums, but sometimes we get some stuff that we don't want when we get all the good stuff from mums too. So yeah, another little tangent there, but we're tapping all the tangents tonight. I love it. It's absolutely fascinating. Is anything else coming up for anybody? Because yeah, I've been delving into a few different things tonight. I feel kind of a little bit like we've been going all over the map. I don't think anyone's popped anything else into the group. Let me just check. No, nothing else in the WhatsApp group from anyone that hasn't been able to attend. Paula, please feel free to jump in if you've got anything that's cropped up. If there's anything in any of that you have got even any insights, if you want to share any experiences, please let us know. Because yeah, it's just really, really helpful. The one thing I think I've been finding this year is that there's power in the wisdom of others' experiences, and we forget this. We often book onto courses, or we're in formal, like university style education facilities for things, but actually there is a beauty in the wisdom of us women just getting together and sharing our life stories. I really do feel that we've been missing some of this, and I have learned personally so much from actually just having some really deep, meaningful conversations with people so far this year, and of all ages. And I've made some amazing new friends that are maybe like a couple of decades older than I am. And hearing their life experience and their wisdom has just blown me away. Like I really feel that we don't give the wisdom of women credit, and we don't tap into it enough. I don't think we there is society doesn't really value it enough, and I feel that we need to tap into that, because it's gold. Like, it's absolutely gold. So yeah, I've been learning so much this year from all of my amazing friends that I've been making, that we've been sharing stories and life experiences, which has been fabulous. Yes, I'm sure you're acting like a big sponge right now, because I've been talking about a whole load of things. It's really funny today, actually. I was away getting my legs lasered. I don't know if anyone knows Mandy Buchanan, but she has Skin Kind in Dalkeith. I go there to get my legs lasered. Have to say, getting laser for getting hair removed is one of the best decisions that I've ever made in my life. It's amazing. But we were having a really, really interesting conversation today. So again, tapping into this amazing woman's wisdom, and she was asking me some questions about, like, how do you find out all the information for all the stuff you know, Claire? And I was like, I don't really know. And I was trying to think of all the different places that I learn from, as well as my university degree, my diplomas. But I listen to loads, I read loads, like lots of podcasts, I tune into different people. So yeah, it's been absolutely amazing. And she was asking me some really interesting things about hormones, because she does a lot of hair removal, so she works a lot with women who have hormone imbalances and polycystic ovarian syndrome. So they maybe have the hair that grows on their face is like kind of in the shape of a beard, very much a kind of androgenic facial hair appearance. So she was wanting to learn a little bit more about hormones, was asking me a bit about PCOS and a whole bunch of other things today. So yeah, I felt like I was giving like a little webinar but in person today. So it was really interesting. Paul, it's interesting that when I was younger, my parents were always giving us herbal remedies, from their grannies and their youth and their culture. And we just thought it was so weird. Now, of course, the wisdom of it all makes sense. Isn't that beautiful, though, that you've had that beautiful input. I do feel as well, like, even in Scotland, if we think about the witch trials, witches were always healers. They were our midwives, they were our nurses. Like, they were the ones that we would turn to in the village when somebody was really ill and we wanted answers or we wanted to feel better. And these women got persecuted, and we lost so much knowledge, whether it was about how the body works, how birthing of children works, of herbs and all of their properties. Like, there was so much healing and health wisdom and knowledge that was lost. So yeah, if you're able to connect back to that, I think that's amazing. And a lot of it is cultural. It is kind of ingrained in the culture, and it's normalized through the culture and society. And nowadays we kind of separate health and doing things for ourselves as something that's not normal, and it's not part of our culture, and it's like, it's not really societally accepted. Like, if you're ill, you're not brought in and looked after more, you're kind of shunned. You're ill, we don't want you anywhere near us, we want to isolate you away from everybody else. So it is a completely different way of approaching health and illness. So yeah, I love that it's all making sense to you. It's all seeming like a lot of wisdom. And I bet you that some of those herbal remedies were bitters. So I bet you they were stimulating and making that digestive process a lot easier by stimulating the digestive enzymes. I love that. That's fantastic. Thank you for sharing, Paula. That's brilliant. I love it. I'd love to know what the herbal remedies were as well, actually, because obviously in different parts of the world, we could maybe have quite similar cultural, in terms of, like, there would be a kind of set natural remedy that people would go to, but it would be different because obviously the plants that grow right across the globe are all different. So yeah, I've been having a look at some of the ones that we don't get in the UK. Oh, bitters. Definitely bitters. It tasted horrid. Yes, Yes, some of them are very, very, very bitter. Yeah, I think we could definitely dilute them a bit so they're maybe not quite as mouth puckering. But yes, um, oh, Angie, you've been eating pineapple lately. Delicious. Absolutely fantastic with some of the digestive enzymes in it that it has. Do you get a fuzzy fun feeling tongue as well when you've been eating the pineapple? Does it give you a funny tongue feeling? I'm actually pretty good. I can probably, not that I recommend eating a whole pineapple, but it would probably take me about a 3/4 to a whole pineapple before my tongue would start feeling it. I love pineapple. It's amazing. Yes, you do have a fuzzy tongue. Yep, it's going after your tongue. Like all the beating in it is going after your big meaty tongue. It's wanting to break your tongue down as well. I love it. But that's a really good what we call hormetic or hormesis, hormetics or hermetic stress. So it's a small stress on the tongue that's going to make the cells of the tongue even stronger. But like if you go to the gym, do a bit of a workout, do some like if you do weights or anything and you've got a little bit of muscle breakdown, again, hormetic stress is all about breaking down but building back stronger. So it's a little bit like that, even for the tongue when you're eating pineapple. Same if you were doing heat therapy or like cold water therapy, wild swimming, ice baths, short, little bit of stress, the body builds back better. So yeah, again, hormetic stress is a whole other course too. Yeah, all the amazing wisdom tonight. I love it. I've had lots of things pop into my head that I'm like, oh, I'd love to tell you about this. But yeah, I have to rein myself in a bit. Fantastic. Well, if nobody's got any other questions or anything that they would love to share, if you do, please pop it in the comments. I'll wait a few moments just to see if anyone has anything that they do want to add. But this basically brings us to the end of our 6 weeks of Belly Bootcamp, and it has been phenomenal. And I really do hope that you have enjoyed this journey with me. It has been amazing. I love delivering this. This is super exciting for me. Lots of aha moments for everyone, lots of just golden nuggets of information. And the biggest thing for me is giving you the understanding and knowledge about how your body works from the basics, and then you can pick up the nuances and the differences for you specifically, but then understanding what all of those signs and signals, whether it's pain or bloating or gas or brain fog or bad skin, whatever those signs are that your body's giving you, you now can tap into why it is that you're getting those signs, and you've now got the tools to address it as well. And that for me just gives you the confidence to be able to make really informed decisions around your gut health, which, as we know, impacts our overall health because the gut is connected to absolutely everything. So yeah, I love empowering you to understand yourselves better and to be able to take some really amazing, confident, informed action when things are maybe not quite as you wish them to be. So please keep me updated. Please let me know what's happening. I love to know how things are going on. I will keep the Ask Me Anything WhatsApp group open for another couple of weeks. So yeah, if you've got any questions, fire them in there. If you've got anything to share, any aha moments, any photos of anything, maybe you've had a really amazing colorful eat the rainbow style lunch or dinner that you'd like to share with the group, please feel free to pop all of that into the WhatsApp group and let everyone see what you've been up to. It's brilliant as ever. Thank you, Angie. It's been fantastic, Paula. Thank you so much. That so warms my heart. I know more than you know more than my doctor. It isn't hard actually to know more than the GPs or even some of the specialists. Like I know for myself through my own thyroid hormone journey that I know more about the thyroid than my so-called thyroid specialist, my endocrine doctor, who actually heads up the endocrine facilities and clinic at the Royal. So yeah, I know more about what impacts certain parts of the body purely because I have had a personal interest. So I've delved down that rabbit hole and found out a lot more information than they ever get taught or are allowed to talk about in their roles. So we have to remember that doctors also often get like ring fenced. They're just not allowed to talk about certain things because they are under the strict orders of a medical board, general medical council, etc., etc., etc. So yes, they are handcuffed sometimes in terms of the information that they can give over. So we can have that conversation, and that's even more important, because there is nobody telling me what I can and cannot say. So we can talk about all of the information and be very open and honest about it as well, and talk about from personal experience and insight. So yes, Angie, it's not ideal. I do feel for our NHS medical professionals, because even when they come to prescribing things, it's like, let me get the big book out. What am I allowed to prescribe? What's the medical board agreed to allow us to give you? It's really difficult. It's really, really difficult. So I do really feel for them. It's a challenge. But I am just so glad that you guys have been here with me. You have been an excellent group. You've been so engaged. It's been absolutely amazing. You've asked some phenomenal questions. You've definitely made me think and go and find out some information on a couple of points. So it's been wonderful. But yes, don't think this is a full goodbye. You're working with me anyway, so we will have future consultations, and you've still got the WhatsApp group. Please, please use it. And if you've just got a random question, even in 6 months or a year, drop me an email. I'm very, very happy to answer questions. Always love it, especially when they get me thinking and how things are all joined up. So yes, please stay in touch, and I will see you very, very soon. Thanks so much, guys. Take care. Bye.